From WRAL News and the Capital Broadcasting Podcast Network, this is your coronavirus news brief for Monday, February 15th. I'm Deborah Morgan. Before we get into the latest stories, we want to ask a favor. We're trying to get a better understanding of what you, our listeners, want to hear in this podcast. We have a survey that takes about 5 minutes to fill out, and we would really appreciate it if you would fill that out. You can find it at WRAL.com/coronapod. Again, that's WRAL.com/coronapod. Thanks so much. Now for the latest coronavirus headlines. Over the past week, we had our first large vaccination site in Wake County. Though it was far from the 35,000 plus doses that were given in Charlotte at Bank of America Stadium and the Charlotte Motor Speedway, our reporter Adam Owens learned that it's just the beginning for Wake County, a practice round of sorts for when the vaccine supply increases.
I want to get it. Get it over with.
Ed Romine was among the first to roll up and get his vaccine.
Ask you a bunch of questions, give you the shot.
That was the game plan at PNC Arena, where Wake County's first drive-through mass vaccination site was set up in this massive parking lot.
This is important because it helps build capacity.
1,000 people got the vaccine at this event. There are 1,200 more booked up appointments at PNC Arena on Saturday.
This is going to prepare us for the next step. As the number of vaccines entering Wake County increases.
When you take population into account, vaccine doses to Wake County from the state have been low compared to other counties in North Carolina. Consider this, a little more than 2,000 people will get the shot over 2 days at PNC Arena. At a mass vaccination clinic at Charlotte Motor Speedway last month, 16,000 appointments were handled in a weekend. Matt Calabria is chair of the Wake County Board of Commissioners.
There are some indications that we're going to be getting more vaccines in the short term, nothing that we're able to talk about right now.
The size of the vaccine wait list in Wake County is about to spike. Right now, there are about 80,000 people on it. Governor Roy Cooper announced educators and others will be added to the wait list in a couple weeks.
At our current pace of doses that being allocated to us, we still have a ways to go.
David Crabtree was also able to talk with Dr. Betsey Tilson about the vaccine supply issue, along with other topics like new CDC guidance on mask wearing. Here's our conversation.
Let's first talk about the CDC's recommendation to wear 2 masks. Do you think we should all begin following that guidance?
So I want to clarify, the CDC, it's not really new guidance. It's clarifying guidance on the most optimal way of using face coverings. Throughout, they've been saying that multi-layer face coverings are the recommendations, 2 or 3 layers. So they are reiterating that you should have at least 2 layers. And you can achieve that either by wearing a cloth face covering that has 2 or 3 layers, or you could wear a disposable mask with a cloth face covering on top of it. So it's still that reiteration that multiple layers is what we want people to achieve. The other piece that's exceedingly important is the guidance around proper fit. You want to be sure that when you're wearing a face covering, it is covering your nose and your mouth, and it fits very snugly. So thinking about using like a metal wire to put it close on your nose and making sure there's no gapping around your cheeks. So those are the 2 clarifications from the CDC: properly fit, snug fitting, and multiple layers, at least 2 or more layers.
Earlier this week, we discovered that the South African variant is here in North Carolina. The UK variant we have been concerned about as well. So talk to me about how concerned we should be. Are we overplaying this as media regarding a new variant, or is it something that we really need to be focused on? And what can we do about it, if anything?
Yeah, so what we do know is that viruses shift all the time. We expect it to be their variants. We expect there will be more variants. This is what viruses do. They shift all the time. So none of us should be surprised that there were variants and not surprised that they're in North Carolina. We were expecting it. This is what viruses do. But what the important piece is that some of the shifts can make them more easily transmittable, so easier to spread from person to person. The data that we have so far is that these variants haven't really seen an increase in the severity of the disease, but more easily transmitted from person to person.
One more thing I'd like to talk with you about are what's known as mass vaccination sites. Some members of the legislature are saying to us today they're a little concerned that possibly, and I use the word possibly, having a mass site like in Charlotte where there are thousands of doses expected to be given, here in Raleigh a couple of thousand doses, have these in any way taken away from smaller rural counties?
Well, when we think about our allocation strategy, we're trying to balance speed and equity, geographic equity, racial equity, ethnic equity, and so we're balancing that. I think that in the beginning, when we were really trying to make sure we had a jump start on our speed, having these bigger sites were a really great way to get that kickstart.
For the North Carolina Coronavirus Podcast News Brief, I'm Deborah Morgan.